Vanakkam all. I am Revati Prasad. I welcome you all for this applied holistic and clinical nutrition program. Thank you so much for choosing this program, and I'm sure that this is going to add strength to your practice. So let's get started. So let me introduce myself. I have done my BSc, MSc, and MPhil in food and nutrition with 15 years of experience. And I've been working under my brand, Revati's Diet and Destiny. And I'm also associated with certain organizations. So, to name a few, I'm working with Holistic Nutrition Works. There are lots of projects going on. So, I'm associated in corporate wellness, PCOS reversal, diabetes project. Also, I'm associated as a faculty in students internship training program, which is under Holistic Nutrition Training Program. And I'm also associated with Global Doctors. It's a platform of collaborative platform of healthcare professionals and medical professionals across the globe. And now currently pursuing my holistic nutrition training under Dr. Suresh Kumar. And I'm also a certified diabetes educator by Dr. Mohans. So my experience, to name a few, I've worked with a few hospitals, namely Triple M Vijaya Hospital. Then I've even worked with Pink Fitness One. Pharmax is a service provider, so for which the Johnson & Johnson company I've worked with, it is basically a glucometer thing. So you would have heard about the One Touch. So I worked as a diabetes educator for Johnson & Johnson. I've also worked with Britannia, Kellogg's, Horlicks. And I've also delivered a lot of talks about nutrition in corporates and schools, to name a few corporates, Infosys, CTS, TCS, a lot of things like, Hindustan Petroleum and PricewaterhouseCoopers, and even schools. And now currently I'm featuring on Mega TV, Pengal.com Unave Marandu. So I've been associated with this channel for now an year and still on. So I've delivered almost 100 plus talks so far. And my achievements, I've been honored R&D Sadhana Award this year 2022 under entrepreneur category. And it's not only me in this program. I've been doing it in collaboration with Holistic Nutrition Training Program. And to say about few, so the HNTP, I can say this is the main base for me to come up with this program. So HNTP is an online training program for healthcare professionals. So this program is training medical professionals, doctors, dietitians, physiotherapists, whatnot. So anybody who's actually into healthcare field, so they are in this program. And here how we've been trained is that here we've been trained to treat a person rather than their disease. So it is all about more talking about mind, body, soul connections. And I can say precisely that we are being taught the connections between the thoughts, emotions, and physical manifestation of disease in the body. And to say about my mentor, Dr. Suresh Kumar Unnamatla. So he's the chief coach and the founder of HNTP and HNW. And he's an MBBS doctor by academic qualification, and he has been associated with so many other organizations. But his passion was always with the nutrition. So he always believes that to treat any health condition, there should be a complete approach. So he always believes in the holistic approach. And for further details, you want to know more about HNTP, just visit hntp.online. So now let's get into this program, Applied Holistic and Clinical Nutrition, which is in short AHCN. So for whom this program is actually planned for? So this program is planned for my dietitians, my fellow dietitians. So it could be the students or whoever practicing dietitians. So this program is going to really add strength to your practice. And next comes why. So why is this program? There is always a story behind every initiative that happens in the world, right? So why this program? So my story is very simple. I feel like, you all would have felt in some point of your life. Suppose if there is a person who can really guide you in your practice, you could have practiced it in much better way, and you could have helped people in much better way at a higher level. So the same reason behind the story, behind this program. So whenever I was working in any organization, when I joined as a fresher, I hardly got any support from my fellow dietitians, especially from the senior ones. So that really made me think about, if I would have got a proper guidance from my senior people, so I would have definitely got into better practice. I could have helped many people at a higher level, at an optimum level, I can say. So I felt like, okay, if this is the case, if I didn't experience that, why not me coming up with this program, so that it would help many dietitians, and so they can practice it without any confusion, with more of confidence, and it could be like a support for you. This program, definitely it is going to be a support for you. So that's the reason I came up with this program. And another reason why this program is all about, so there is always a difference between the story and the reality. I mean, the reality and the theory. So we've been given lots of information or lots of knowledge during our college days. But the thing is, like, when it comes to reality, it was like completely the flip side. So many of you would definitely agree with me, because very simple example. So we all have done menu planning or diet planning for certain given cases, right? So if, for example, diabetes. See, we would have very easily planned a diet, saying some two parathas for breakfast or two idlis for breakfast. But when it comes to reality, is that two idli or two paratha is really sufficient for a person? It never happened. It never matched, right? So I always felt that the theory aspect and the reality aspect doesn't match. So I felt like this program could bridge that, the story, I mean the reality and the theory. It'll be a bridge kind of thing, so it will really help you to put whatever you've learned, but in a better practical approach. So I'm sure that these two reasons, you all will be with me, because every dietitian, whoever have started practicing or who's going to about to start your practice, these two things are always there with us. So somebody, if somebody can guide me, I can do it better. And there is always a gap between the reality and the theory part. So this will be definitely sorted out in this program. So now, next we'll go on to the next slide. So here it is, what you're going to learn exactly. So this program is really going to give you more confidence in terms of how to do a basic counseling. So even for a practicing dietitian, sometimes we do miss certain data, and we really, break our head why this thing is not progressing, that the result is not happening. So it is all about learning about the basic diet counseling techniques. So what kind of questions you need to make, and how to do an assessment. So what are the questions we need to really ask in. So these things you will be learning in this program. And once you assess the client or the patient on basis of the 24-hour recall, or frequency of consumption, or the physical activity, anything, and definitely we need to really do the blood reports. Certain cases we require blood reports. So how to read those blood reports, what you can conclude from that, what you can really infer from that. So you're going to learn that. And you're also going to learn all possible reasons and causes for any existing health conditions. For example, so in my practice, what I observed is like, generally if it is in diabetes, which is like very common cases. So diabetes, generally people see, say for example, if a client comes with a higher fasting blood glucose, so we generally come into conclusion that, okay, if the fasting glucose is really high, probably the previous day's diet could have played the role in it. But we have to really look into it, is especially in one of my client case. It so happened that the client used to have the dinner around 9 o'clock, 10 o'clock in the night, and he used to check the sugar around 5 o'clock in the morning. See, generally there is a protocol that you have to maintain a 10 to 12 hours of fasting. Only that gives you the right kind of a fasting blood glucose. So this is just a example I'm telling you. So you need to really understand, and you should have that list of all possible reasons why this health condition is existing. So this is in terms of clinical aspect. So coming to the holistic aspect, so you have to really understand or address your client in all 360-degree of the patient, because we always believe in that stress plays a very major role in manifesting any kind of illness, right? So we really need to understand their lifestyle, what kind of lifestyle they have. Is the lifestyle itself is causing some kind of a stress, which is very, very important to so how to go about, so how to ask few questions in terms of understanding their clients, your clients lifestyle. And also you're going to really learn like how you're going to connect those emotions with your physical manifestation of the disease. So emotions, thoughts, everything has got a very close connect with the manifestation of any disease. So you're going to learn about that. And overall it is going to really boost your self confidence, and you will be equipped for all the possible challenges you're going to face while you handle a client. So these things you're going to learn in depth. And next is the content. So I just will get you through the contents. So the contents will be including the history taking, which is like the demographic and family history, and then comes the medical history, under which you will be learning about diagnosis, medications. And the third one will be nutrition assessment. So you will be learning about the quantity, quality analysis, food allergy, social habits, stress eating. So everything has got interlinked, and it has got more to do with the information, in the sense like why you ask certain questions, why you need to ask certain questions, and what is the reason behind it, what kind of information you can get it. All these things can be collected from your client. And next is very important, the diagnostic parameters inference. So once you see a blood reports, how to infer from that, what you need to really learn, and what how to produce, I mean what say proceed with the um, intervention. So this is going to really help you. And there are a lot of things which I'll be sharing in this module. And the third thing is the dietary intervention. So I have just come up with very common health conditions. So all these things, the dietary interventions will be addressed. And trust me, I'm not going to really go with all the principles of diet planning, since because you all would have learned it in your college and you've been practicing. But I'm going to teach certain other dietary interventions which is not much common, but it is very, very effective in terms of reversing a condition. So I'll be showing throwing some light on it. And very importantly, it will be like the 7 areas of life. And so physical health, personal health, social health. So this is really going to help address the stress of the person. And so I'll be sharing gist of it, how to go about it. These things, as a coach, as a holistic nutrition coach, you really need to know. And what are the tools what we use as a holistic coach? So these are all the following tools, like acceptance, forgiveness, gratitude, meditation, breath work, journaling, creative visualization. As I've already told you that we are going to cover the client or the patients in 360-degree view, 360-degree angle. So we are like making sure that the client or the patient I mean, not given any chance of not seeing the results, but the results are becoming very sure short one. And also, I'll be sharing all these inputs, whatever I've done. So these things, I'll be sharing it as a case study where I have practiced, I have put it all these things in my client's thing, and what I've learned, how to, really do the practical aspect of it. So I'll be sharing case studies of diabetes, PCOS, thyroid, renal, and IBS. And also there will be a bonus section of live discussions. So once I'm done with all the modules, once it is done, so we'll be having a weekly or twice a month we'll have a live sessions, so which I'll be planning it in short. And references is like I definitely completely dedicate this program to HNTP, especially Dr. Suresh Kumar. So he's the one man behind this program. When I told him like I want to do this program, so he was very happy, and he's the one who is actually helping me out. And all the knowledge what I've gained is from this holistic nutrition training program. And the knowledge what I'm sharing is my learning, so my experience with the clients, and also definitely with learnings from my fellow coaches. So all these things put together is the content of this AHCN program. So thank you so much for being with me. So let's get started. And we'll see in the next module. Thank you so much.